Hiya, hello, and welcome to a webinar recording of Yarning and Indigenous Methodology that was scheduled to be presented on the 14th of August for the Circle Club. My name is Dr. Bep Uink. I'm a Senior Research Fellow at Kulbardi Aboriginal Centre in Perth, Australia, and I'm very excited to share this presentation with you. I would like to also begin by acknowledging the ancestors of my ancestors, so the Noongar people of the southwest of WA, and extend that respect to the ancestors of Wadjuk Noongar Budja, which is the country in which I'm currently living and growing on. And I also would like to extend my respects to the elders and acknowledge the land that people are joining this webinar from. By way of introduction, I'm a Noongar woman. I come from the southwest of Western Australia, so right over on the west coast, but I've grown up here in Boorloo or Perth most of my life, and I work here at Kulbardi Aboriginal Centre. So on the screen there, you can see us outside having a yarn, the topic of today's conversation. And it very much represents the fact that we spend a lot of time in conversation and in relationship with each other at the centre. So I'm a research fellow there. Our primary projects that we run are Walkern Katatdjin, which is a study dedicated to understanding the social, emotional wellbeing and mental health of Aboriginal LGBT young people, as well as RAAYS, which is racism and allyship in Aboriginal youth spaces, understanding experiences of racism and how we can interrupt them for Aboriginal youth. So before I kick into a definition of what yarning is, I really wanted to reflect on why I think it's such a powerful method in research or methodology. And so I wanted to give examples that I've reflected on from my own work about when we build space for relationships in research and particularly in data collection, and when we don't and how that can go wrong. So my first example is from the Walkern Katatdjin project. So we were interested in finding out what it's like to be growing up as Aboriginal and queer in Australia. And we were very mindful to give participants yarning circle questions and prompts that we had well before they came to the yarning circle so they could prepare. When we started the yarning circles, we also introduced ourselves as facilitators first by placing ourselves in relation to our own sexuality and gender, as well as our cultural identity and our connection with country, which is an important part you'll see of the methodology. We also started with a whiteboard exercise. So although we had pre-specified questions that we wanted to ask and a discussion guide, we made sure to ask people at the start of the session, what are the things or topics that are really important to cover today? And then we circled back to the whiteboard by the end of the yarning circle to make sure that those topics had been covered. So most of our participants were over 18 years in the study, which meant that we were able to have direct contact with them. We could negotiate when we were going to meet them. They could negotiate on the spot how long the yarning circle went for and whether they wanted to come back from a yarn. And my own reflections on that experience, as well as feedback from participants, was that it was a very empowering experience to take part in that research. On the flip side, a couple of years later, I ran the Racism in Aboriginal Youth Spaces study, and this was with teenagers. I was talking about this study in a forum, and a colleague asked me whether I thought that the young people felt empowered talking about their experiences of racism during this study. And I sort of reflected on this feeling that I'd been having and this nagging feeling that perhaps it wasn't as empowering as when I'd done work with Walkern Katatdjin, and I also felt it felt a bit extractive taking the data from these young people. And so I thought about what the difference was. And with these young people, because we were recruiting through high schools, our primary mode of contact with them was facilitated through schools. So this meant that the timing and the location and the duration of the focus groups that we ran was highly determined by the school when the young people were available. And we tried to fit the data collection into a class schedule, which meant that we actually had minimal time to build meaningful relationships with the young people in the study. So although we still tried to include yarning methods, and I still think we got some valuable insights, we introduced ourselves to participants and we provided our own examples of the racism we'd experienced. I don't know if it was as empowering as when I've used yarning in Walkern Katatdjin. So what is yarning? So first and foremost, to understand it as a methodology in research, we have to understand that yarning comes from a cultural practice. So before it was a research practice, it was a cultural practice. And when I think of yarning myself, I think about an experience that's quite different to how I use it in research. To me, it's sitting on the balcony with my nan, listening to stories, and knowing not to interrupt those stories out of respect. So very much a one-way knowledge sharing, could be very circular, and oftentimes those stories were imbued with some form of meaning about a life lesson. And so I pulled this image on the screen, which is from a NAIDOC poster, which to me represents how yarning feels to me when people mention it and how I grew up with it. So yarning can be shared in multiple ways. For example, it's a knowledge sharing technique shared through ceremony. So for example, the man in the top left of the poster who's doing a smoking ceremony. Knowledge for Aboriginal people can be shared through doing activities, for example, the weaving that's happening. It can be through song and dance, but it also can just be sitting and talking with an elder or someone who holds knowledge, as it was for me. And through this presentation, I wanted us to reflect on how that methodology has come into research and why it has come into research. I then want to talk through a couple of the elements and principles of yarning. So it's not so much a method with steps that we follow, it's a whole methodology underlying which are principles. I then want to discuss briefly the ethics of non-Aboriginal people's use of yarning in research and present possibilities for using yarning methodologies to assess clinical change in interventions. So to understand yarning in research, we need to understand the justification and the rationale. So Aboriginal people brought this cultural practice into research with us as a way to fully appreciate Aboriginal or realise an Indigenous research paradigm. So that is understanding that as Aboriginal people, we have different ways of being in the world, different ways of knowing, and different ways of doing. And central to those Aboriginal ways of knowing, being, and doing is this notion that knowledge isn't something that just exists for us to extract, but it's something that's co-constructed and something that's shared for the benefit of others, not something that's owned by one person. And second to that is the concept of Indigenous relationality. So this notion that as Aboriginal people, we come to know ourselves through our relation to others, ourself, to our spirit and our ancestors, and to our country. And all of that is important in bringing that into the research space for authentic practice. And because of this, I really like the definition provided by Barlow that yarning is a relational methodology for transferring Indigenous knowledge. So the rationale is threefold. It's an indigenisation of research because it acknowledges that, again, for us as Aboriginal people, knowledge is co-constructed and develops through conversation and connection with others, including non-human others. It's an anti-colonial project because it represents the idea that it sort of rejects the idea that we must do research in a colonial paradigm for it to be proper. And it's decolonising because it rejects colonial research paradigms, which are primarily extractive, again, seeing that knowledge is something to be extracted from participants. So Barlow actually presents these 6 principles that I think really sum up yarning and its power. So the first thing is that knowledge is a gift, and it is something that is shared with you by Aboriginal people, the knowledge, but you have to be a willing participant to receive that gift of knowledge. There's also a great emphasis on who has control. So in yarning circles or in yarning methods, participants, not researchers, have control over the yarn. They have control over the topic, the content, how long it goes, and its format. So some people may be comfortable sharing knowledge through talking, whereas in other instances it might be more appropriate to share knowledge through singing or dance or art. This also gives participants great freedom in deciding how and when and in what format the knowledge is shared. We also talk about making sure yarning is taking place in the appropriate settings. So very much knowledge in Aboriginal cultures is place-based, And oftentimes there can be great power and great specificity to knowledge that is attached to a particular place. And holding a yarning circle on the place where that knowledge is stored can be very powerful. It's a very inclusive method. So it's very much that everyone is invited to join the yarn, including non-Aboriginal people, as long as they're willing to be that receptive recipient of the gift of knowledge. And there's also gender and age specificity around cultural protocols. So for some groups of people, for example, on certain topics, gender differences may come about and people may want to split across genders to talk about things. And in age, someone might defer to an older knowledge holder who's seen as having more respect in the community. Oftentimes, yarning is compared to semi-structured focus groups. And I think this is a mistake, and I'll explain why. So although there's similarities between the methods, so both try and answer a research question that's preset, and both do that through open-ended questions with participants to probe for further answers. But first and foremost, the aim of semi-structured interviews is to extract information. So it aims to extract participant thoughts, feelings, or beliefs about a topic. And in contrast, the aim of yarning circles is to facilitate a relational space where knowledge can become shared and co-constructed. There's also minimal personal sharing by the researcher in a semi-structured format, whereas it's actually very much part of the methodology in yarning circles. So personal sharing of how the researcher is connected to country and locating themselves in relation to the topic is very important in building that connection. Semi-structured interviews and focus groups are based on white cultural practices where they emerged. And again, as I said, yarning is based on Aboriginal and Torres Strait Islander cultural practices. Because of this, semi-structured interviews are not situated in place. So overall, we may think as researchers that we think about the most appropriate place to hold a focus group or an interview for participant comfort. Yarning takes this further and talks about, well, do I need to actually be on the country where this knowledge is held to get the most authentic version of this information? So the context, the physical setting of the yarn becomes very important. Another really important aspect is relationality. So this is a diagram taken from an Aboriginal scholar, Atkinson, who actually mapped out the family and cultural relationships that they as a researcher had to everyone in a yarning circle that came along. And this is very much important. This mapping is done at the start of all yarning circles and one-on-one yarns, but it's not often mapped and caught and analysed as data. So as you can see from the picture, everyone in the yarning circle was somehow related to each other, either through being part of the same country, the same cultural group, or they'd worked for the same organisation at one point in time. To me, that image just says safety to me. If I knew I was in a room with people that were that connected, I would feel some sort of cultural safety. It's also really important to do that at the start of a yarn because it establishes the hierarchies in the group that might be culturally important. For example, if someone's a very senior knowledge holder in the group, other participants may want to defer to them when talking about knowledge throughout the yarn. So as I said at the start, the way I use yarning in practice is quite different from how I use it in a research context. And so I think that's because the way that it's talked about in research is one's sort of way, and it's actually a spectrum. And I encourage researchers and students to consider the type of information they're on and where they fall along the yarning spectrum. So for me, at one end of the spectrum is storytelling. So this is very much the yarn I grew up with. And I would use this in research if I wanted to hear a relatively uninterrupted story, and particularly by a senior knowledge holder. So I would want to hear that knowledge from an elder, for example. It would be very participant directed and of course would be place-based. Further along the spectrum, if I was actually interested as a researcher in wanting to co-construct knowledge and actually get conversation going between people and see how that evolves and how knowledge around a topic is constructed in that way, I would go towards a yarning circle or just a one-on-one yarn if I wanted to have more interaction with the participant. Again, it's very heavily participant directed as a method because participants are interacting among each other, talking and discussing, and then maybe taking the yarn to a different topic, which in some way is related back to the research question. And then on the other end of the spectrum, I have what I call yarning style focus groups or interviews. So this is when you want to construct knowledge on a topic, but I would use this when I anticipate there is going to be a lot more participant scaffolding by the researcher, and there's little room to explore off-topic things that come out in the yarn. And I think it's going to be very research-directed, the conversation. So the example I gave at the start of my talk with the racism study, we had a lot of prompts with participants. We had some activities that were going to help them discuss racism. And so we knew it would be quite directed. And the limited time we had with them meant that we weren't able to necessarily allow those conversations to extend and evolve as they would in a full yarning circle. So in this sense, I refer to that as yarning style. It's still yarning style because we did build that relationality with them and we did situate ourselves with the participants. So more a yarning style than a semi-structured focus group. All of these methods, again, are situated in place. So thinking really carefully about the context in which that knowledge comes to people. So how is yarning being used in research? Here, I think it's important to talk about the difference between method and methodology. And we know as researchers that method is a way of collecting data. It's the steps that we follow and the procedures and tools that we use. Whereas methodology is the broader rationale or the justification for the choice in how we collect data. And the rationale for yarning methods is honouring Aboriginal ways of knowing, being and doing, and Aboriginal ways of knowledge sharing. So we know that methodology should sit around method, but we also know as researchers that this often doesn't happen. And I also want to point out that methodology is a felt experience. It's how we go and process being in relation to participants and the research question and the data we're receiving back, and how we're reflecting on that information as we go through a research project. I also wanted to flag the 4 phases of yarning that were talked about, that are talked about by Dawn Bazarab and Nyanggu. This is a very seminal paper about yarning research. And they talk about a social yarn, then turning into a research topic yarn, as well as this collaborative yarn and a therapeutic yarn. I'm not going to go through these phases, but I just want to touch on them for how these are being used, unfortunately, as method, as I've seen in research, rather than methodology. So what I do see in research often are 2 examples. First is in grant submissions, where non-Aboriginal participants, will have a grant submission, or the author will say non-Aboriginal participants will complete semi-structured interviews and Aboriginal participants will complete yarning circles as if they're equivalent. So it is falsely equating yarning circles with semi-structured interviews, where again, we've talked about how the primary purposes of both methods are different. I also hear researchers often in medical research, in healthcare research, where they talk through the research questions were XYZ, and yarning circles will be used or were used to answer these questions. And I often see that in healthcare evaluations when it is quite clear that the healthcare intervention hasn't been at all developed from an Indigenous standpoint or out of respect for Indigenous research methodology. And researchers have sort of just brought yarning in to be a culturally appropriate method of collecting data. But again, when it's divorced from that Indigenous standpoint, we can question whether we can actually appropriately divorce method from methodology. And if we do this in the context of yarning, are we still being true to its anti-colonial roots? Unfortunately, with the 4 phases of yarning, we are seeing researchers who take that as quite a stepped approach, as in I go for this and then I go to this phase and then I do this phase, and it becomes quite procedural. And we see them trying to fit it into a colonial research paradigm, which to me is the antithesis of why we would do yarning. So how do we move forward from this? I wanted to give an example of a thesis by a student of mine, Rebecca Famlonga. So when I became involved in this study, It was a multi-site, step-wedged, randomised controlled trial in very remote places in WA, in communities of Aboriginal people, and it was aimed at treating and preventing skin infections, of which there's a large problem in remote communities. And it was trialling all these efforts, all these different types of approaches to preventing skin infections and treating them. And as I got involved in this study, it was around about the time that COVID-19 came. And with the COVID-19 restrictions, remote communities in Australia were shutting down and weren't letting external visitors in for health reasons. And so the researchers on the study were very concerned that they weren't going to be able to revisit the communities to finish their final year of screening and collecting data to see if the trial had been effective. So they came up with a question as to whether skin checks, which were part of the surveillance they were doing, could be done remotely through something called teledermatology. And that's when the research landed on my desk with a student. So we had a couple of options that we talked through. So first of all, we could have run a yarning circle with community members and ask them about the feasibility of using telehealth for skin checks. A second option is we could sit and reflect on whether this was actually the main research question and the main priority for community members to have answered. Remember that the research question initially came from the research team. We wanted to know, actually, are there other things that the community wants to tell researchers, and how do they want to tell us? So we can't just assume because they were Aboriginal community members that they wanted to use a yarning methodology. And then we also needed to think about how can we create spaces to hear about skin health or things that are important to skin health in the community. And what we ended up with is a much wider, broader research question, I think, about what the story of skin health was, both past, present and future for Beagle Bay, which was the community. And in talking through this, the community members were actually happy to have a discussion about telehealth for skin checks, but only in the context of this greater discussion around how they wanted to take charge of skin health in the future. So I've pulled some excerpts from the research journal attached to this project. And I think it really shows the principles we talked about at the start of the presentation of yarning. So the researcher did employ a community co-researcher because they weren't from the community. And so having a local member was recommended to help do the research. And they had initially thought that the participants in the community would only be happy to have the community co-researcher run the yarning circles. But the first reflection here is Famonga talking about, in fact, it became clear that the community, wanted me there in the yarning circles to confirm their trust in the research and process. So very much this was a reflection, I think, on the control that participants had in determining who was going to run the yarning circle and having the freedom to be able to dictate, no, we do want the researcher there. We think it's important she's there because we can show that she's invested and she's actually engaging in this process. There was also the principle of space. So the researcher went out to the community upwards of 10 times across 6 months because they knew that it was very important to actually be on country where knowledge about skin health, both pre and post-colonial, was held to be able to access that knowledge. And the topic was actually based on participant preference. Like we said, it wasn't actually just based on a research question formulated by the research team. I also think inclusivity and gift are shown because I think this researcher, Famonga, actually really tuned into the fact that knowledge about skin health and how it had been looked after and how it was being looked after in the community was really powerful. And so she talks about the trust she built with participants by showing up. She said, I didn't have an office space to work from, and I didn't want to impose on the home of the community co-researcher. So I waited in the car in an open space next to the community store until community members were available to talk. I would have delayed or broken trust if I did not show this patience. And so again, yarning can be quite an inclusive method. And initially the researcher thought she wasn't going to be invited into those yarns. But the fact that she showed up, she waited, and she showed patience for when people felt comfortable, I think allowed her into those spaces. So what about non-Aboriginal people's use of yarning, given that it is a cultural practice? I want to talk through a hierarchy of decision-making that I've adapted here from generally the question around whether non-Aboriginal people should be involved in research with Aboriginal people. And so the first thing I would think about if you were thinking about using yarning is what is motivating you to use that method, and thinking about how you came to know about yarning. So have you learned it as a cultural practice growing up with Aboriginal people? Have you learned it from reading a paper? Have you learned it from observing from this webinar? And what is making you think that it's an appropriate method to use to collect data? What's the rationale? And you might want to reflect back on that spectrum of yarning in terms of what are you actually trying to hear from participants? Again, if you do decide to go forward with yarning, thinking about how it came to you. Have you actually had experience with yarning? Do you need to have more experience with it socially before you use it in a research project? And I think this applies to any cultural practice that has been brought into a research space. If you are going to use it in your research project, I think the next question is whether an Aboriginal person is better placed, or an Aboriginal team member is better placed to run the yarning circles or interviews. So like one-on-one yarns. If that Aboriginal person has grown up in that community, they have an intricate knowledge of how that yarning and how that relationship works and the cultural protocols of that community. And because yarning is so heavily predicated on that, and the authenticity of the information that comes out of yarning as a research method is because of those abilities to form those relationships, you might want to think about whether there's someone better than you in that sense placed to run the yarn. But if you do decide to go ahead with it, the important question is, can you meaningfully play a role in the yarn? And I think you can as a non-Aboriginal researcher if you lean into the idea that it's more than a way of collecting information. It's about creating and being in a relational space with participants. And so I think it is about observing. I think it is about being close to people and understanding how people interact and share knowledge, rather than necessarily picking up a paper and reading a methodology or method steps. So finally, I wanted to touch on the possibility of using methodologies, yarning methodologies, to assess clinical change after intervention, because I think this is work that some of the audience members might be involved in. And I'll go back to this idea of contrast. So on the left side of the screen, you'll see a snapshot there from the audit alcohol screening tool, which you may be familiar with. So for example, if people were going through a drug and alcohol intervention or an alcohol intervention, you may give them this pre and post, right? And it's how many drinks have you had containing alcohol? And there's a frequency. How often have you found that you started not able to stop? Standard questions from the audit, right? And you could give someone that and they might fill it out. I want you to contrast that to if you took a more relational approach and sat with them and interviewed and started by asking how they had been after the intervention, but before and after the intervention. Asking things like, tell me what it's like, what life has been like for you recently. Has alcohol been much of your life since you started the program? And importantly, what has been the most meaningful change in your life across this period? And it might not have anything to do with the intervention. So if we rephrase it so that assessing post-intervention change is actually coming to know a person's story while they've been involved in the intervention, I think we can take a highly relational approach through something like yarning to find out whether our intervention is effective. And I think the bonus there is that you might actually find out other positive side effects of the intervention that you wouldn't capture in a typical screening tool. So that is it for the presentation. Thank you for watching. Please do reach out to me if you have questions or if you just wanted to learn more about yarning. Please contact me there. There are my contact details, and also feel free to look at some of the our labs research that I've referenced. And I also want to just give a thank you to the partners who've been involved in all of the research I've talked about today, as well as the funders. Thank you.